Lauren's talk today is Youth Rugby Union in Ireland, a look at injury, epidemiology and prevention. So thank you, Lauren.
Thanks very much. And yeah, I think it's obviously rugby, a different maybe topic to bring us through from the last talk, but there's an awful lot of similarities in terms of the concepts, methodologies, and indeed barriers to kind of, I suppose, implementing what we know from a research perspective into the real world. So there is definitely some similarities across the two. I'm going to briefly bring you through the Irish Rugby Injury Surveillance project. It's a project that's been running since 2016, nestled mostly over in the PES department, but definitely has some input from different departments across the university. I'm bringing you on a very quick whistle-stop tour with indeed maybe a little bit more focus on what I'm doing. But I'm sure as researchers we are interested in talking about what we're doing ourselves. So when I consider speaking at something like this, I'm always trying to keep in with the theme. And the theme today being research with impact. So I always sit and kind of think about what does that mean to me? And just for the sake of clarification, I'll always Google the definition of a term. And the very first one that comes up is really quite ironic. It's the action of one object coming forcibly into contact with another. So it's definitely act, but maybe it isn't the true meaning of impact that we're looking for today. So that is to have a marked effect or influence. And to just frame that from the Irish Rugby Injury Surveillance project, and I'll use IRIS for short, that's how we tend to title it. I'll talk you through some of the aims of the project. So it is primarily funded by the IRFU, so the Irish Rugby Football Union. The project started back in 2016 and it was renewed in 2022 to bring us right up to 2030. And indeed there are some other funders, so thank you very much to those also. But the funding, I suppose, was given to the IRIS project itself for two main aims. The first of those was to establish an injury surveillance system for the collection and the analysis of different injury trends that might be occurring within the community game, and then to identify some causal factors or some preventative strategies. And the second aim, I suppose, is probably more so important from an impact perspective, and that is to enhance the health and welfare of rugby players that aren't playing at the professional level. So those players that mightn't have the same access to support staff, mightn't have access to coaches that maybe have the same level of expertise. So to enable us to enhance their health and welfare. I'm working specifically within the youth side of the IRIS project, and even more specifically within the Senior Cup competition. There may be some people in the audience that are very familiar with the competition. For those that aren't, it is the elite schoolboy rugby union competition here in Ireland. It's an under-19 competition, but it caters for players between the age of 16 to 19. At the moment, we're in our 5th season of data collection, and up until the end of last season, that was injury surveillance from just under 11,000 hours of competitive rugby union within that specific age grade. Up until this season, we've had 65 different teams partake, and that accounts for about 60% of any school that is eligible to play in that competition. That 11,000 hours equates to about 623 games, so a lot of rugby. And the fulcrum of this project, or the main person that makes it all happen, is the injury recorder. So we have an embedded injury recorder within each school team, and it is those that record the injuries on behalf of the players, and they liaise with us. We audit that data every week to ensure of its accuracy. And I suppose across the last 4 seasons, we've had up to 465 different injuries recorded. That's not including training injuries, and we've a couple, maybe over 100 already this season. So it's a huge data set, and I do want to acknowledge Dr. Therese Leahy, who would have collected the first 2 seasons of that data. But in terms of the impact, this competition has quite a big impact. If you hark back to 2020, when there was an awful lot of things happening in the world, the Shannon, a motion was brought to the Shannon to play the Leinster Senior Cup final, given its importance in the sporting calendar. But from impact, from our perspective, that looks like an injury report that's published each year by the IRFU. That's a quick look at one of the report covers there. But if we were to dive very, very briefly into what that injury data looks like, the orange column that we see there is the injury incidence per 1,000 hours of Senior Cup rugby. And it's around 42 injuries per 1,000 hours. And to be honest, it sits probably where we would expect it to, in that it's a little bit lower than international under-20 competition. A lot of those players that would have been registered last year on our project will be taken to the field with the under-20s in the Six Nations this January. Then the AIL, which is the adult competition. So a lot of those players, when they move out of the Senior Cup competition, go into the next two columns. So it pretty much does make sense. The last two columns are professional rugby, so a little bit away from where our players are playing currently. Over the last 4 years, some very clear trends have emerged. Unfortunately, it is the head and the shoulder that are the most frequently injured locations, followed then by the knee and the ankle. In terms of types of injuries, ligaments tend to be affected in terms of ligament sprains, concussions, and then also muscle strains. And then when we look at what's responsible for these injuries, unfortunately it is 2/3 the tackle. So 66% of match injuries are occurring as a result of the tackle, and that's why we're seeing so much focus on the tackle when it comes to maybe some media coverage of the game of rugby itself. Impact, again, well, this data has allowed the IRFU to be in a really, really strong position to actually modify or change the game, change the laws of the game to make the game safer for our players. So World Rugby called for nations to opt in to the tackle height adjustment trial, and that would have started last season. And this would have meant that the tackle height that would have been at the level of the axilla was dropped to at the base of the sternum, which would encourage athletes to actually tackle at the belly rather than higher up. And the IRFU are in a fantastic place where they have 3 seasons of school data, 5 seasons of adult data prior to the tackle height adjustment, and now 2 seasons afterwards. And we're one of the only countries in the world that have that level of data to determine the efficacy of that trial. But in-house, I suppose, what's the impact of this data? And it's the development of Engage. So this is what you might be more familiar with calling an injury prevention programme, but we call it the Engage Readiness and Robustness Programme. And that's quite a intentional terminology in that we do want to attract coaches to actually using this programme, so putting it back into their language. But this is a neuromuscular training programme that was designed by Dr. Patrick Dolan, and indeed a lot of the data that was filtered into this programme came from Dr. Katrina Yeomans. But it's a neuromuscular training programme that optimally should be delivered to players 3 times per week, for about 15 minutes. And it includes a collection of different exercises, both to physiologically prepare a player for the training session at hand, but also to prepare that player across the season for the demands of rugby. And indeed to, I suppose, specifically attack the head, the shoulder, the knee and the ankle to improve the robustness of those various sites in terms of the prevention of injury. My colleague, Dr. Patrick Dolan, has looked into the efficacy of this programme. So it was trialled 2 years ago prior to that tackle height trial. And he got 5 different clubs to use this programme across a full season, and then compared it with 16 different clubs that didn't use the programme. And we saw some pretty positive results. So in terms of the rate ratios here, the reference group would have been the control group, and then that would have been compared with the intervention group. So we're seeing some nice results there from a preliminary pilot perspective, indeed, with regards to concussion, shoulder, hamstring, knee, maybe not so positive on the ankle just yet. But starting to move towards where my interest is around the actual the use on the ground of this programme. So coaches that use this programme within those 5 clubs were really quite agreeable in terms of its use, its feasibility on the ground with their players. But we do know that just because a programme is good doesn't mean people are going to do it. So my work has really dived into the effectiveness of the programme and indeed the implementation of the programme itself. So my work has really been with coaches of rugby players. This is a coach of the international women's side. And what's framed my work is around trying to improve adherence. And we know that there is a dose-response relationship, so the more often you do it, the more benefits you're going to receive. But when coaches are reporting multiple different barriers to not being able to do it, adherence then obviously falls, and then they aren't getting the benefit of the programme itself. Fidelity is a big thing as well. So while we could hand them a document that gives them the entire programme, very few are actually going to do it as per the prescription. they're often changing it to adapt to better fit their context. So these are all considerations that I had moving into the implementation space. And we know that there are a couple of different drivers of implementation, but knowing, I suppose, our boundaries and how much impact we can have, we've chosen to look at competencies, the competency of the coaches in terms of their delivery of the programme itself. So a very quick snapshot of what we did. The first thing we wanted to establish is what's happening. What are coaches currently being offered? And if we know that, hopefully we can make some progress from there. So they are being offered a workshop. They're being offered one workshop, and it's just one contact point. Very few of those workshops are underpinned by a behaviour change theory, which is unusual considering it's the behaviour of the coaches we want to change. And there's very little in-season support. And where we did find there was in-season support, it typically wasn't for the purpose of improving the competency of the coach. It typically was to actually just ensure that the programme was being done, or there was fidelity with the programme. So research procedures, really. Then when I went to look to the literature to establish, well, how should we do this well? I found nothing. There was no literature out there to establish how do we better prepare coaches to deliver injury prevention programs. There definitely was some literature around what do coaches like to look at when they want to learn. But when you, I suppose, compare coaching a rugby team in its general sense versus being handed a program that was quite prescriptive, I didn't think it was fair to extrapolate one and apply it to the other. So we asked the coaches, well, what do you actually want? And yes, they do want a workshop, but they want a live workshop. So currently the IRFU offer a click-through course on their website. It's not live. They want to be able to ask questions. They ideally want it at their own site, which I know brings with it some logistical and pragmatic barriers. They want to develop their implicit learning, their implicit knowledge of the programme. So again, we have really, really nice wallet cards, but if I have a coach of an under-10 team in front of me and they don't feel that they can use that particular exercise, they want to know how to modify it to better fit their 10-year-olds. They want facilitated peer learning, which is interesting. Karen earlier was mentioning about the empathetic peer support. We can translate that to the coach environment too. They want to learn as much from each other as they do from us, and they definitely want better resources. So what did we do? Well, we developed a 2-part workshop series. We offered it to coaches in the pre-season because that's when they wanted it. It was theoretically underpinned. So we did look at the health action process approach. We looked at various behaviour change techniques. We also brought in some motor learning strategy because again, a lot of these coaches have no idea how to do a Nordic hamstring curl. So we do have to teach them as well to do the exercise and then be able to teach them how to teach that to their players. We developed some new resources in addition to the ones that already existed, and we trialled that across 9 sites with 111 coaches. And there's some nice snaps there to document that. And again, I'd like to acknowledge some of my helpers, some PhD students, Killian and Laura, with regards to that. So just to bring that to a close, this is currently in my last phase of data collection. Our primary aim is really to look at the coach workshop series and does it fit the needs of the coaches? Does it do what it says in the tin? Is it acceptable and is it appropriate? Some of our secondary aims then are around the adherence side of things. So did we actually change any of the behavioural determinants that we know are correlated with adherence? And then what actually was the adherence midway through the season? And then what's the fidelity? And maybe not the fidelity in the true sense of the word. We're not looking for coaches to do the programme as prescribed. We want to know, how did you change it? What did you change? And I'm very interested to see how much it changes based on the age of the players that they're working with. So stay tuned for that. Hopefully it'll be at a journal near you soon, in the coming years, I'd say at this rate. But just to finish up, some acknowledgements. Kieran, my supervisor, is in the room. Tom and Ian couldn't make it today. And also some of the wider, or all of the wider Irish team across the PES department, health sciences, maths and statistics. And just a signpost to some of the very interesting work going on with the rest of my colleagues. Killian Bibby is looking at contact breast injury and exercise-induced breast pain. It's a fascinating PhD. Laura then is looking at the management of concussion in the domestic game here in Ireland. Tabitha is looking at RED, so relative energy deficiency in rugby and in other field sports. And then Dara is looking at some of the behavioural elements of changing the tackle. It's quite an embedded skill set, and then to suddenly change it when you're an adult rugby player is an interesting topic. But yeah, if you have any questions, feel free to ask or drop me an email. If you're interested in the project itself, there's a QR code there. And if you're interested in the actual programme, there's a QR code there as well. But thanks for your attention.
Thanks a million, Laura. That was excellent.